Welcome to episode 9 of our video podcast. Today, we're going to talk about Medicarehub Limited outreach care services. Stay tuned.
Hey everyone, and welcome back. We're doing a deep dive today on something really important. It's Medicarehub Limited's outreach care program and how it works here in the UK. I mean, we all know how hard it can be, especially for adults, who may have some health challenges. It's tough to just keep up with daily life, let alone actually, stay independent. So that's what's so interesting about this program. You sent me over some materials from Medicarehub, and we're going to really break this down. Like, what is this program really all about? How is it trying to make a difference for people here in the UK? So to help us understand this, I've got our expert on healthcare and social support systems here with us. Welcome.
Glad to be here. Yeah, there's a lot to dig into with this program. It's quite interesting.
It is. Yeah. So Medicarehub's outreach care, what's the big idea here?
Well, I think at the heart of it, it's really about providing a safety net, for those adults who need extra help. To, live their lives at home and live fulfilling lives at that. And the way they go about it is really pretty comprehensive. They tackle things from the really practical day-to-day kind of hands-on help, all the way to the emotional side of well-being.
Yeah. And that's what's so interesting to me when I was looking at this stuff that you sent over. They offer personal care, which, includes things like help with bathing and dressing. And I can really see how, especially for someone who's struggling with mobility issues or a chronic illness, that could really be essential.
Oh, absolutely. I mean, those are often the first things that start to become really difficult for people. And, and just having help with those tasks, it can make a huge difference in someone's life, their sense of dignity, and their independence.
And it doesn't stop there. They also have something called practical support, which is, assisting with things like meal prep and errands. And that to me sounds like, if you're someone who's dealing with some health challenges, that can feel really overwhelming. So to have that help, I imagine, takes a lot of pressure off.
Yeah, you're right. Those everyday things can become major hurdles.
Yeah.
If you're not feeling well, or if you're dealing with, some kind of limitations. And it seems like Medicarehub really gets that true independence goes beyond just medical care. It's about having the support you need to actually manage your life.
Okay, so we've got like the practical day-to-day stuff, but they also offer health monitoring, which includes regular checkups.
Yes.
And help with managing, chronic conditions, which to me seems like that could be a real game changer in terms of preventing, bigger problems down the line.
Right, and that's where I think the preventative side of their program really comes in, because by catching things early, and providing that consistent support, they can potentially reduce hospital admissions, they can improve overall health outcomes. And there's a lot of research out there that supports this kind of proactive approach.
That's so important. But what I found really interesting is their focus on emotional support. It's not just about the physical needs. They offer companionship and even counseling services.
Yeah, and that's pretty fascinating, because it seems like they're recognizing that there's a real link between mental health and physical health. Loneliness and social isolation are huge problems, especially as people get older, and they can have a serious impact on health. So addressing those needs is really a crucial part of any kind of holistic care plan.
And they even go a step further with rehabilitation and enablement services. I saw that they offer things like
ability exercises
and activities to help with, cognitive function. So it's like they're not just trying to maintain someone's current level of functioning, but actually help them improve.
Yeah, that's a really important distinction. It's about empowerment. Instead of just doing things for people, Medicarehub seems to be focused on giving people the tools and the support they need to regain skills and confidence.
So we've talked about, these individual services, but one thing their material stresses on the importance of collaboration. They talk about working with healthcare professionals, social services, family members.
And that's where things, I think, get really interesting.
Yeah.
And it's a key indicator of how effective a program like this can actually be, because they're not operating in isolation. They're actively coordinating with GPs, social workers, therapists, really creating a network of support around each individual.
So how does that work in practice? I mean, are there challenges in coordinating all those different people?
Oh, of course. I mean, you're always going to have challenges when you're dealing with different people, different priorities. Sometimes, communication can be a challenge.
Yeah. You're
making sure everyone understands the program. But when you can overcome those challenges, the potential benefits are just enormous. Think about it. You've got the GP who's focused on medical treatment. You've got the social worker who's looking at maybe social determinants of health. And then you have the family providing emotional support. So when you get everyone on the same page, sharing information, working toward the same goals, the individual really gets, much more comprehensive care.
Yeah, it's like a safety net that's woven together by all these different threads, right? And I imagine that leads to better outcomes overall.
Exactly. And speaking of outcomes, Medicarehub's pretty bold.
Yeah.
The claims they make about the benefits of their program. But it's not just marketing hype. There's actually real evidence to back up a lot of these claims.
Oh, that's good. So what kind of benefits are we talking about here?
Well, one of the big ones they talk about is improved health outcomes, which I know is a pretty broad term. But they highlight specifically a reduction in hospital admissions. That's not surprising given their focus on preventative care and early intervention. I mean, studies have shown that community-based programs like this can reduce hospital readmissions by as much as 20%. And that has a ripple effect on overall health.
Wow, 20%. That's huge. And I imagine that translates into cost savings as well.
Absolutely.
Yeah.
For the healthcare system as a whole. But it's not just about the numbers. It's about, the individual's well-being. Imagine being able to stay out of the hospital and recover in the comfort of your own home.
Yeah, that's a huge quality of life improvement right there. And it ties into another benefit they talk about, which is increased independence.
Right. And that's not just about physical independence either. It's about feeling empowered, to manage your own life, make your own choices. And by providing the right support, Medicarehub's really enabling people to stay active participants in their communities for as long as possible.
And that makes me think about the psychological impact of that. Feeling independent and in control can have a huge impact on your mental health.
Absolutely. And that leads into another key benefit that they highlight.
Yeah.
Enhanced quality of life. By addressing not just the practical and medical needs, but also the emotional needs of individuals. They're really creating an environment where people can thrive, not just survive.
Yeah, it's not just about adding years to life, it's about adding life to years, right?
Exactly. And all of this has a positive impact on family members and caregivers as well. Caregiving can be incredibly demanding, physically and emotionally, and Medicarehub seems to recognize that by offering respite care and support for families.
So they're really thinking about the whole picture.
They are. And by supporting families, they're actually also contributing to reduced hospital admissions. When caregivers are exhausted and stressed, they're more likely to make decisions that lead to hospitalization for their loved ones. So by providing that respite care, Medicarehub's kind of alleviating that pressure and potentially preventing unnecessary hospital visits.
It's like a preventative measure on multiple levels. And it makes sense, when everyone involved is supported, the person at the center benefits the most. So let's say someone's listening to this and they're thinking, wow, this sounds like it would be perfect for me or someone I know. How do they actually access these services?
Well, Medicarehub lays out a few different pathways. First, you can get referrals from healthcare professionals. So that could be your GP, a nurse, a therapist, anyone who's already involved in the person's care. And can see that they could benefit from this kind of support.
Makes sense. I mean, people trust their doctors and nurses, so if they recommend something, it carries a lot of weight.
Exactly. And it also just makes the process a lot smoother. Healthcare professionals already have a lot of the information they need to make a referral. So it's less paperwork, less hassle for the individual.
Then there are referrals from social services. Can you talk a little bit about how that works?
Sure. Social workers are often, really on the front lines, identifying people who are struggling, connecting them with resources. They have a really deep understanding of the social determinants of health. So they're in a great position to, recommend Medicarehub to people who they think could benefit.
So it's a way of making sure that people who maybe don't have strong family support systems can still get this kind of care.
Exactly. They're not just waiting for people to come to them. They're actively trying to reach the people who need it most. And of course, family members and caregivers can also make referrals.
That's important too, because sometimes loved ones are the first to notice that someone needs extra help. But what I thought was really interesting is they also encourage self-referral.
Yes, that's a big deal. It really puts the power in the individual's hands. If you think you could benefit from this program, you don't have to wait for someone else to refer you. You can reach out to Medicarehub directly.
That removes a lot of barriers, doesn't it? It really sends the message that they're accessible.
It does, and that they want to help. And they've made it pretty easy to get in touch. They have a phone number, an email address, and a website listed in their materials.
So in a nutshell, it sounds like Medicarehub is offering a really comprehensive and accessible solution for people in the UK who just need a little bit of extra support.
I think so. And what's really impressive to me is how they've combined, that practical assistance with healthcare management and emotional support into a truly holistic approach. They seem to understand that independence and well-being are really interconnected, and they've created a program that reflects that.
It makes you wonder, could this be the future of care?
Yeah.
It really is interesting to think about. You know how these kinds of programs could change the way we think about aging and caregiving in general?
It does, doesn't it? It's like instead of, viewing aging as this inevitable decline that leads to, dependence and frailty, they're framing it as, a phase of life that can still be full of purpose and meaning with the right support.
Right, and that makes sense because people want to. Maintain their autonomy and stay connected to their communities. And wouldn't that have like a positive impact on society as a whole? I mean, if more people are able to live healthier and more independent lives, wouldn't that reduce the burden on, healthcare systems and social services?
It's certainly a possibility. It's something worth exploring. Imagine a future where community-based care is the norm, and it prevents or delays the need for a more intensive and costly interventions. I mean, it would require a real shift in thinking, but the potential benefits are huge.
Yeah, it's like a ripple effect. By investing in preventative care and community-based support, we're not just, helping individuals, we're potentially transforming the whole system.
Right, and it's not just about systems and structures either, it's about human connection.
Yeah.
Medicarehub's emphasis on companionship and emotional well-being, I think that really highlights how important social interaction is, especially for healthy aging.
That's something we don't always think about. We tend to focus on, the physical and the medical aspects of aging, but those social and emotional needs are just as important.
Absolutely. Yeah. And programs like this, I think they remind us that, well-being, it really encompasses all aspects of a person's life.
Well, this deep dive has certainly given me a lot to think about. It's really inspiring to see organizations like Medicarehub, really kind of taking this comprehensive and forward-thinking approach to care.
It is. And it's a reminder that we all have the power to shape the future of caregiving, whether it's through advocating for policies that support these kinds of programs or volunteering our time, or even just, checking in on our elderly neighbors. I think we can all play a role in creating a world where aging is embraced and celebrated.
That's a great point. So as we wrap up today, what's one key takeaway that you hope our listeners will walk away with?
I hope they feel empowered to explore the resources that are available and to advocate for themselves or their loved ones. Whether it's Medicarehub or another program, there are options out there. Don't be afraid to ask for help. It's not a sign of weakness. It's a sign of strength.
That's so true. And remember, everyone, the information for Medicarehub Limited is in the show notes if you want to learn more. Thank you so much for sharing your insights with us today. This has been a really fascinating conversation.
My pleasure. I've enjoyed it.
And to our listeners, thanks for joining us. We'll catch you on our next deep dive.
We hope you enjoyed this podcast. Please visit our website to learn more about our services at medicarehub.co.uk. Bye for now.